Hey everyone, I know you've been waiting to hear from me what the neurologist said, and I know it's 3 in the morning here where I'm at, but this past week since I've went and a few days since I've been back have been rough, recovering physically and mentally, just coming to grips with it all. So thank you for giving me some time. But I want to share with you the news that I received. Before I tell you what happened in New York, I want to kind of go back over some of the history of what led me to this point through my other specialist and then also through the first neurologist that I saw. They were finding problems, all the other specialists, in other aspects of my body, such as the gastroparesis. My GI was talking about, a lot of times the phrenic nerve, not the phrenic nerve, the vagus nerve isn't working right to trigger the stomach to empty. So thus again, another neurological possible route to this that would further connect all these systems. Then I have the laryngospasms, which my EMT recently, when she did a laryngoscope where she stuck basically a camera to view the spasm, she said that it didn't look like your typical laryngospasm nor vocal cord dysfunction, as my vocal cords were fine. It was actually looking like dystonia, which is laryngeal dystonia that was neurologically driven, which was basically where the muscles kind of wither and contract and spasm and close off, because it wasn't constant in nature. It was kind of like coming and then relaxing slightly, but enough where I couldn't get air up. Now to use my other trade. So once again, she was also concerned, and had been from the beginning, but seen it again just a few months ago. She's like, you've got to see a neurologist. Same thing with my bladder and the urinary retention, me not feeling when I had to go, and me not being able to void, having to go through all the suprapubic catheters, the 2 that I had implanted just to be able to relieve myself. The self-cathing, they did a urodynamics test, which tests the nerves that go to your bladder. When they filled my bladder up, it should have gone, the electrical activity should have gone crazy. My nerve was showing no electrical activity when I should have been sensing that I really had to go, because I couldn't feel it. And so, once again, pointing to more neurological issues with the nerve. That's why I got the bladder stimulator, which has helped, thankfully, to give me some normalcy in that aspect. But all of these specialists, even including my pulmonologist that I've seen for years, was saying that, yes, you have asthma, but this just is not your typical asthma presentation. There is other stuff going on that is causing this respiratory failure, these recurrent pneumonia, sepsis, and especially all these other things that I have going on. So all of these specialists were saying, hey, there's something neurological going on. We want you to see the neurologist, and I did. And when I told them they found nothing, they basically said that I was weak, having spasms, and nothing pointed to a connection other than that. And then later they called it critical myopathy. And when I had my first EMG and neurological evaluation, as you can see, here's the notes. It said that neurology was consulted and basically showed hyperreflexia. My reflexes were heightened in the lower extremities, weakness, and some sensory level loss. They did MRI, spine, brain, nothing came up. My EMG it says abnormal, diffuse neuropathy, myopathy, nor motor neuron disease was not found. However, I had fasciculations in the right FDI muscle, basically in the hand, and right tibialis anterior muscle in the leg, as well as impaired relaxation and testing spontaneous movement, are abnormal and suggestive of CNS pathology, so central nervous system, brain, spine. A repeat study in several months may be helpful in identifying pathology not present on today's examination. And then came out with the diagnosis, muscle weakness. So basically that's all that I was diagnosed with. After the first time seeing that neurologist, then he referred me to a neuromuscular team neurologist. So I went to see the neuromotor neurologist at Vanderbilt after my limb, leg, and arm EMG, the muscle testing and nerve conduction testing, and it said basically at the beginning she made sure to bring up and put my past experience of PTSD and some depression, anxiety, made sure to mention that at the beginning of her note. And then she said EMG, reassuring of non-anatomical lesion present, myopathy, polyneuropathy, so basically nothing present, likely paramyotonia, which is basically muscle stiffening, was seen in the exam and caused the fasciculations. She said EMG will be repeated. Acute onset degenerating disease is unlikely and would be evident on today's exam if began April 21st, which she meant the last hospitalization. She said, however, no pathological reflexes, so reflexes were normal at that point, even though when I watched her, I could obviously tell they were brisk and abnormal. Normal strength, which I will disagree completely with this. She half-heartedly did a muscle exam on me and told me in her notes when I read it that patient was giving way, which I can read documentation and I can know what that means, and that basically means that I was not putting forth the effort, but she still marks it as normal strength, even though there was specifically weakness throughout. Discussed with patient that this is reassuring and that degenerative neurological disease is not something to be desired. Okay, so that statement right there was stating in a non-accusatory way, but if you actually read it, it basically means that she was saying that I wanted to have a neurological disease and that's why I was there, and I was upset because I was disappointed they weren't finding it. No, I was upset with the fact that she wasn't thoroughly evaluating me, and because I had that history of PTSD and anxiety and depression, that she was basically leading to the fact that a lot of this was psychological, even though it's not stated. And she also mentioned the vocal cord dysfunction, which as far as what they found was laryngospasms. She was saying it was due to the intubations and due to acute laryngeal injury with posterior glottic and subglottic ulcerations. That's what they said was the issue because I was coughing up blood. But when they actually went in to do my trach, I went back and read the surgery notes, and it said that I didn't even have injury and that everything looked clear and good, but I was still having a laryngospasm under sedation. Thus they had to do the tracheostomy to get me off the vent. And then it said defer to ENT and pulmonary for vocal cord dysfunction and asthma, like that was the major issues going on. And my diagnosis from this was spasm of muscle. And the neurologist at that point explained that I was just weak from being in the hospital and that I will get better. And I asked her, how did she know? She said, because all tests point to there's no progressive neurological disorder going on based on what we're seeing. And I said, well, then why haven't I? And she said, just give it time, it'll happen. And she kept saying, well, you don't want a neuro disease. No, duh. Why in the hell would I want a neuro disease? The problem I was so upset with was they weren't finding anything, but my body was telling me there is something going on, and I felt that they were ignoring, especially the neurologist, things that were going on. That was where I was. They wanted to refer me back to another neurologist in Vanderbilt system, but I just felt like that I couldn't get a fair assessment, especially with how I was gaslighted before and how much it hurt. I never really, checked back with neurology because it was a dead end, and I felt like they were going to go down a road that it was more psychological induced. Unfortunately, a lot of vaccine injured out there have been told it's all in your head, there's nothing wrong, and I didn't want to go back to her and get a diagnosis that I was further labeled with that. She hadn't put it yet, but I felt like she was going in that direction. That's why, again, I stress the importance of reading your notes and seeing what they write about you. Not only what do they say to your face, because you will find out a whole lot. I'm not stupid when it comes to documentation and know how to elegantly put something when you're trying to get the point across. So that led me to the point I needed somebody that was going to listen, somebody that was going to hear my story and really investigate what was going on. And so that's when I had heard about this neurologist in New York, but didn't take insurance and was going to be quite expensive. I started the inquiry last fall for this guy and found that out. And the grant that I wanted to get that was maybe would help me was closed, but then it opened up this year. I was able to apply through React 19, and thankfully I was completely blessed with receiving this grant, because there would have been no way I would have saw him. So the neurologist that I saw in New York was one that specializes in rare neuromotor disorders triggered by autoimmune and immunological responses. So your body attacking itself, causing the neurological things to occur. He's a mainstream neurologist. He's seen people I know personally with vaccine injury. So he recognizes that it can trigger things, and listens to you and thoroughly investigates and does a non-biased evaluation of it. So when I got there, he did a clinical neuro assessment. He found weakness in legs mainly, but some in arms, and found sensory loss. My reflexes were diminished now. Instead of being brisk and hyper like they were before, now it's minimal. Then he did EMG and nerve conduction. I know I've mentioned these prior in this video, but to explain, EMG is the electrical activity of the muscle, and nerve conduction is the electrical activity, how fast it flows through the nerve that goes to the muscle, because you can have neuro diseases that affect both or one or the other, and sometimes motor and sometimes sensory, and those kind of check both of those. So he did that, and then he also did a tilt table test, which talks about testing autonomic issues, how your blood pressure and heart rate are supposed to respond when you go from different positions, such as lying to standing up, and how your body is normally supposed to react, because there are involuntary systems, and that's called the autonomic nervous system as well. And when the autonomic nervous system, there's something going on with that, those involuntary regulations that are controlling your body in different systems, they don't work at. And then he also sent me to the hospital for some blood tests. So he told me that from these tests that it showed that I had severe impairments in the nerves and the way the muscles are supposed to respond to that nerve innervation. I had severe issues in all of my limbs, arms and legs, more severely in the legs right now. That it is acquired and he told me that it can happen after a multitude of things. He said it's not really understood as the causes, but there is proof that it does occur through things like post-vaccination, which causes an inflammatory immune response where your body starts not only trying to create antibodies and immune response to attack the intended disease to be vaccinated against, but now it recognizes your body as the enemy and starts attacking your body, and that's the acquired. Said that in common terms, or what you hear more often at diagnosis, is CIDP, and he is saying that is what I have. That's another word for what I have. CIDP, you may have heard about. It is chronic inflammatory demyelinating polyneuropathy. The demyelination part, which is the neurons I was talking about in the demyelination. The normal ones, you can see the green areas, those are the areas called myelin. Those are around the neuron, and they help basically speed up the transmission and create that normal, healthy, fast connection between the brain and the spinal cord and the muscle, telling it to contract. And without those, it's slowed down, and that can lead in CIDP. Your body, your immune cells, the antibodies are attacking that myelin sheath and destroying it. And when it's destroyed, that's what's causing the slowed connection, the disconnection between the brain and the spinal cord and the muscles, leading to the symptoms that I'm having. The muscle twitching, the fasciculations, the spasms, any kind of disruption in that cause the neuropathy, the pain, the numbness, the tingling, the burning that I'm having. All of those symptoms through the demyelinating process. Also tested positive on the tilt table tests. So what those basically meant, along with his clinical assessment, were showing that the diagnosis were POTS, which is postural orthostatic tachycardia syndrome. So breaking that down, postural, obviously the position you're in. Orthostatic means kind of that change in position to coming upright. Tachycardia being increased heart rate. So POTS, he said, is an example of an autonomic dysregulation, things that my body is supposed to compensate involuntarily through the autonomic nervous system was not working, or is not working. Those were my two diagnoses that I came out of. He went on to explain, because I was inquiring about, well, I've had these other issues like gastroparesis, my stomach not working and emptying, the urinary issues of retention, not filling and being able to avoid, and the laryngospasms. My brain kind of checked out there. The laryngospasms, and how are all these fitting in if CIDP is peripheral? Maybe he kind of explained another component and what he theorizes is going on. What the neurologist said is basically after vaccination, that the heightened immune response started happening, and not only with your peripheral things like your legs and your arms being attacked, such as in the CIDP, then it becomes so inflamed and you have issues with centrally driven stuff, such as other systems of the body. And he said also, when you are in the hospital a lot, not only do you have that post-vaccination issue of it causing the immune response, which I had systemic inflammatory response syndrome, showing I had inflammatory processes going on throughout my body. That basically, when you are in this situation, you have is a critical illness syndrome, and that's why a lot of people in in and out of the hospital, long stays in ICU, on the ventilator, they can develop these issues in other systems in their body. Is theorizing in my case is autonomic dysfunction. Just like I have POTS, which is controlling blood pressure and heart rate response to movement, and that's supposed to be an involuntary thing through the autonomic system, that each of the systems in your body are regulated by involuntary responses, and the autonomic nervous system is what is controlling that. So this inflammatory response is attacking not only the peripheral nerves, but in my case it's also attacking the central nerves, which are controlling more of the autonomic responses and causing a dysregulation in each system, causing those nerves that innervate those things such as the larynx, where I have the laryngospasms. It's giving it mixed signals, then the nerves aren't communicating, causing the spasms, the laryngospasms that I'm having while I have the trach. And then also, same thing with the gastroparesis, the nerve to the stomach. The same thing with the urinarius, is the nerve to the bladder. All of these things have been dysregulated because of the heightened response from the vaccine and the critical illness, both attacking the autonomic system. I have good times, bad times, and a go-between, especially when I have hospitalizations with flare-ups of other infections like pneumonia and sepsis. I mean, 39 years old, and yes, I do have asthma, but I've been in and out of the hospital multiple times with pneumonia and sepsis to that point. And he said, honestly, with that should have been a sign that something more immunological was going on, because being diagnosed with a systemic inflammatory response syndrome, that each time that I was in the hospital, basically, not only did it flare and cause the CIDP in the arms and legs to start attacking more of the nerves and causing nerve damage there, but also was attacking all these other systems. That's why when I felt like I went into the hospital, it felt like that all of the problems that I had would get worse. And each time I was able to recover some, but it also felt like with each hospitalization, my baseline that I went back to was a little worse than the last. You know, there is treatment for this. However, I didn't get it early, and so my response will definitely not be as good as if I had received it earlier. He said, I told him what my first neurologist said, and he said, honestly, when you see fasciculations like that, yes, people can have, when I say fasciculations, that means muscle twitching. People can have that in conjunction with the other stuff you had going on, the neurological issues, the weakness, all of the other systems. That should have been a major red flag. You know, why are you having that? And because they didn't recognize it, because my EMG and nerve conductions were not showing anything other than that at that point, because nothing was permanently or severely damaged at that point to cause issues in the electrical activity, that they disregarded it. And instead of recognizing and taking the full picture in, they were relying on a machine to tell them the ultimate diagnosis, even though they were the beginning of something going on and showing there. So basically, if I would have had this at the beginning, he said that I probably wouldn't have gone downhill nearly to the point where I was today. I probably would have improved significantly with treatment, and I wouldn't be at this disabled point. I'd probably be back to close to normal, and being managed with the flare-ups. But it also has issues when it's not started earlier on. And now I'm over 2 years post-vaccine and post-injury and post all these symptoms starting. So he told me that this treatment he's recommending is IVIG, which is IV immunoglobulin therapy, which are infusions that you take in, and basically it helps suppress that immune response and suppress those antibodies that are being produced in your body. And ultimately, by taking that out, now your body is not under attack. And he said that that is great in the initial inflammatory response, and when you have these flare-ups, to suppress that. But when it's gone on this long, sometimes there's permanent sensory and motor issues, and that it's just time will tell. He said I could have some improvement, I could have a lot of improvement. He said, or you could have no improvement, or it may be something that you're at where you're at, but you'll manage the flare-ups and you won't have the flare-ups causing even more damage once you're on this drug. And so it's nice to have a diagnosis neurologically, and to have somebody sit there and explain exactly what's going on, and theorize, not only taking clinically what's going on, what he sees on the objective test, and taking the whole picture. So going forward, he is going to work to get it approved through my insurance. So not something that I can afford at all if insurance did not approve it and did not pay for it. But he said that he's had good success rates by getting insurances to approve it, especially with what's going on and the diagnosis that he found. He told me once it's approved, however, insurance sometimes requires a local provider that is approved provider through your insurance to actually sign the orders. So I do have a local primary care that I'm seeing, and when I talked to him, he was absolutely on board, no question. He would do whatever he needed to do. Thankfully, if you're around Huntington, Paul Brinkman at the Evans Clinic is awesome. Highly recommend him. He's been great coordinator of all this madness throughout. But he told me that he is more than willing to do with whatever, as far as if this is recommended, that he will get me set up with an infusion center, and a PICC line or a central port, whatever is needed for easy and long-term access to do these IVIG treatments. So that is another blessing. So the first step is getting it approved through insurance, and the next step is doing it and seeing where it leads. So I stay hopeful. And I know people that have been diagnosed with CIDP. I know several that have symptoms of CIDP that have not been diagnosed, that I question. But the ones I know personally, they've had better responses to the ones that had access to it earlier on, after the initial start of symptoms. The ones that I know that has started it later on, especially one individual, she has had good responses. It's just been very slow in coming, so that's hopeful, because I know she's dealing with a lot of the same severity of things I'm having. Other than steroid treatment, which I've been getting, thankfully, because I've had respiratory issues, maybe that has prevented some of the possibilities of, inadvertently, of this being even more worse than it's been. That was one of the treatments, and then IVIG and plasmapheresis. I'm hopeful that this will work, and please pray that insurance approves it, there are no glitches in the startup, and that I'm one of these people that respond awesome to this. And even if I don't respond, at least maybe having started it, I can prevent further progression, and the flare-ups that I'm having won't be as bad. Those are my hopes and prayers for that.